The Prime Minister is reportedly facing his biggest rebellion yet in Parliament since stepping into number 10, with around 80 Labour MPs reportedly set to oppose plans to cut £6 billion from welfare benefits for sick and disabled people.
Campaigners say the changes will push disabled people further into poverty. The government, though, says it has a moral duty to get Britain working again.
Before the pandemic, the government spent £52 billion on sickness benefits. Last year, that figure rose to £65 billion, and it's been forecast that sickness benefits could rise to as much as £100 billion by the end of this decade.
Well, do those benefits stop people from getting a job, or would cutting them back be an unfair attack on vulnerable people? Disability inclusion specialist Dr. Shani Dhanda says these cuts will just push people into poverty. Economic commentator Mark Littlewood thinks the benefits are too generous and being off sick has become a lifestyle choice. Very good morning to you. Dr. Shani Dhanda, £100 billion by 2030. That is a huge amount of money. Can you see why the government would want to cut it back?
Absolutely, and I don't disagree that we do need to reform the system. I agree, but not like this, not at the expense of disabled people. Nearly half of everyone that already lives in poverty is a disabled person or they're a carer of a disabled person. And a high percentage of people that live in destitution are also disabled. If we're going to cut support to the people that need it most, it's only going to push even more people into extreme, deep poverty with the backdrop of the assisted dying bill.
The government says that what's happened over time is that the system has stopped helping people get into work, and then actually the financial incentive means that often people are worse off if they take a job, and therefore you have people in their 20s who are going to be stuck on sickness benefit for 20, 30, 40 years.
I think we absolutely need to encourage employers to do much more. But when we actually look in terms of the rates that people get, it's very difficult to even be eligible for something like PIP. The form alone is 40 pages that you need to fill in. You need to back it up with so much medical evidence. And it's less than £200 a week that people get. How many of us can really live on that much amount of money?
Mark Littlewood, you're Director of Popular Conservatism. You used to be Director of the Institute of Economic Affairs and were an advisor to Liz Truss when she was Prime Minister. Why do you think these benefits have ballooned so much? And do you accept that they might have ballooned for very legitimate reasons?
Well, it's possible. I mean, it seems to me most likely it's some sort of post-COVID psychological reason. And the government's right to tackle this. Right. We have a worklessness crisis in Britain, worse than any other G7 country in terms of getting people back into work after COVID. We've just seen those numbers that we might see this bill increase to £100 billion by 2030. Well, nobody thinks that illness and disability is going to increase at that sort of level. So why would the bill increase? There must somewhere be an incentive problem in the system. So the government's right to tackle it. I would agree with Shani. It's got to be done incredibly sensitively. But we do need to get people back into work. We've got 1 in 8 young people who are not in education, not in training, not in work. That's a huge number.
Is it your analysis that people who are not able to work for whatever reason, that it is more financially beneficial to claim a disability benefit than it is to claim employment allowance, support allowance?
It's possible. That's not really my worry. I mean, I think the big issue we've got here is around mental health issues. Much harder to diagnose, not as black and white as a physical disability. And my concern is that people who might be suffering, I don't know, minor, mild depression are getting signed off work for a long period of time, when it's in the interest not just of the taxpayer, but them to get them into work. It's actually pretty beneficial for the people involved.
What do you say to that? If it's because I think even the government sources have pointed to anxiety, mild depression, that they might tighten up the requirements, which would mean that those people might be excluded from benefits.
We've got to understand we're living in a world where we're talking about mental health a lot more now. I've worked since the age of 16. I've been in work for 21 years. We never talked about mental health when I first entered the workplace. Now it's a massive focus. And actually, when we invest in people's mental health, we get a return on investment, especially from an employment perspective. But we all have mental health, and especially those of us that live with long-term physical health conditions.
But is it reasonable to say to people, as Mark Littlewood suggests, if you have anxiety or you have mild depression, it might be more beneficial for you to be working than it would be to be claiming benefits
with the right support
and not working.
With the right support. Unfortunately, I don't think there's enough employers out there that understand they need to give a level of flexibility. You know, there's such a push to get people back into work 5 days a week in the office.
OK, that's a good point.
You
so
know, for example...
If you're an employer and someone, you know, but we don't know all the firm details, so I don't want to alarm anyone. But if they find out perhaps they're no longer eligible or they're on a different regime, and they come to you and they say, look, I have anxiety and depression, I'm going to be off a little bit. You need to be supportive of that.
Of course.
Are you going to be?
Yes, and I think you need employers to do that. I mean, the best employers aren't those who flog their workforce to death or demand too much of them. The best employers are ones that work around the needs of their employees.
But isn't the reality...
Yeah, that doesn't happen in reality.
I know that employers might choose somebody else. I mean, that, you know, that might be discrimination.
Well, I think Shani can speak to that.
Law,
She's an expert in advising companies about how to be more inclusive about this to their own benefit.
But the point is, if you're going to withdraw people's benefits, you've got to have jobs for them.
Yeah.
And what people in these situations might experience is the jobs aren't there.
That's right. The government is in the unfortunate position of having to do several things at once. One is to save money. The other is to create an economic environment in which there's more employment. That's not going very well. But we do need to save money here. The welfare bill is getting out of control, and the solution to it is more people into the workforce. That probably means a bit of carrot and a bit of stick. That's the only way to solve it.
It's not just that, though, because when we look at really what excludes disabled people, there can be money saved in so many other ways. If someone's accessible housing needs are met, they're 4 times more likely to be in work. We have to approach this in a very holistic way.
Shani, though, we know that the Chancellor is under pressure. She needs money quickly. We're talking about ways to help people into work. ITV reporting at the weekend, part of this is going to be freezing those PIP, those personal independence payments. Under these plans, even those with extreme disabilities in the unfit to work category are likely to lose money. How do you react to the Chancellor planning that?
It's so cruel. It's so cruel because, on average, disabled people face unavoidable extra costs of £1,010 a month. That takes into consideration you receiving PIP. So even if you do receive that benefit, you've still got to find an extra £1,000 a month. So if they're going to cut it even more, where are people going to get this money from? Where are they getting it from now?
Sure. What do you think, Mark?
Yeah, I don't
even those with extreme disabilities, unfit to work, likely to lose. If you're the Chancellor, you have to make, what's it called, tough choices?
There's always tough choices and hard choices, isn't it?
Is this a fair, tough choice?
Yeah, what I'm a bit surprised about here, that seems to me a bit of a blunt instrument. My general complaint about the welfare system is it's all scattergun, doesn't tend to target the money well enough on those who really need it. So in the round, I think we've got too many people who are out of work altogether, and a good number of them need to be helped back. But a subset of those is where you actually need to target the welfare money. So I'm a bit surprised the government's going quite as hard as that.
If you're the Chancellor and you need money right now, you've got to persuade the Office of Budget Responsibility, the independent auditors, you can get it quickly.
Yeah, I agree. That's part of the problem about good policy making. I'd have quite a lot of sympathy if the government's approach was, we think this will work, it won't work quickly, but it will work over the medium term. I'd actually like the OBR and others to say, that's fair darts. Let's stop the short-termism in economic planning and actually encourage politicians to think, how might we solve things over a 5 or 10-year horizon?
Thanks both very much indeed. A lot of response on this. And I'll give you an example. Suzanne says, my son's nearly 21, has Down syndrome. He gets benefits but would love to work. No one will give him a chance. I agree with assessing those who claim, but some claim purely because they cannot get employment at all. Well, the Department for Work and Pensions said the current welfare system's broken, needs reform. They said we have a duty to get the welfare bill on a more sustainable path, and we will achieve that through meaningful, principled reforms rather than arbitrary cuts to spending.
Right.
The trouble is, right now, I think a lot of people are feeling very worried indeed. Mark Littlewood, thank you very much indeed.
Thank you,
Dr.
Shani.
Shani Dhanda.